I firmly believe that HSMA represents the future of operational research and decision making in the NHS.
HSMA has allowed us to use data to use actual operational science and modelling rather than just using our data for pie charts.
It's really exciting to be here today and first of all to see so many of you here to hear about the programme and about what the HSMAs have been doing over the last 12 months. It's a really exciting time, I think, for HSMA because a lot has happened in terms of where we've moved forward with this iteration of the programme. Operational research is fundamentally all about using mathematical modelling, computer simulation and analytical techniques in order to help inform decisions and improve the quality of decision making. This can really make a difference to the way in which services are delivered, improving efficiency, but also improving quality of care, and in some cases actually saving patient lives as we've had before.
My name's Claire and I'm an information analyst for Royal Cornwall Hospitals Trust.
My name's Rohan Kansami, I'm one of the doctors at the RD&E.
My name's Simon Philpott, I work at University Hospitals Plymouth.
My project is titled RCHT Eldercare Workforce Mapping to identify needs and alternatives to cover the frailty pathway.
I'm going to talk you through my HSMA journey over the last 9-10 months called AI.
I was looking at the factors around the length of stay in hospital and the frustrating thing, which is the delayed transfer of care or delayed discharge.
The main goal of the programme is to increase the level of evidence-based decision-making in the NHS. We have seen countless occasions over the years where decisions have been made with little or no evidence and acknowledged to be so. And so actually having tools, having ways in which decisions can be improved and some evidence can be put forward to help make decisions can be vital. And we think there's a real role for operational research to help there.
I wanted to look at where we base our existing frailty workforce in order to impact as many patients as possible.
My project is all to do with my organisation's propensity to cancel operations at the last minute. I think that cannot be right. For a patient experience, that must be awful.
So the problems is one everyone's aware of. There's lots of bed pressures and there's lots of people in beds who don't necessarily need to be there anymore.
So I thought, I'm going to have a look at this and see if there's anything I can do.
One big feature this year is that we had a much bigger cohort of HSMAs. So in the first iteration of the programme, we had 7 applications, of which we took forward 6 HSMAs. This time around, we had over 50 applications for HSMA 2018, which was fantastic to see. Another big change that we've made this year is a move towards free and open source software. And we don't just mean free in terms of money, although obviously that's a clear benefit, but also free in terms of being able to share the models that the HSMAs have developed.
The beauty of this model is it allows me to tweak things and see what changes.
Can modelling help to identify any obvious cause or patterns on this decision-making process?
I wanted to find out, can we estimate the length of stay and can we predict what social care is going to be needed as soon as they arrive?
The HSMA programme is a fantastic opportunity to bring together people from all across different NHS organisations to really collaborate and share ideas.
The learning environment which we had was really open, it felt secure. You could ask a silly question if you thought it didn't matter. We were all learning together.
I've led 2 teaching sessions for doctors about modelling, how to apply it, and just trying to instill in them the idea that they really should do some code or do something, because it'll be our bread and butter soon.
I also start a new job in January, which is data-led service improvement. So I'll have plenty more opportunities for a lot more of this.
But with HSMA support, they made it so much easier to learn.
The outcome will be better care for patients.
And I fundamentally believe that this is the future of operational research. We've had a number of successes within Pencourt over the years in terms of some really high impact projects, and that's great. But there's only so much that we can do. And I strongly believe that it's about getting people within the health service to be able to do this kind of thing within their organisations, to push from the inside, to get this evidence-based decision making really at the forefront of service redesign and analytics in the health service that's going to make the real difference. And our HSMAs who sit here, and our 6 HSMAs, many of whom are here today from the last iteration of the programme, are very much pioneers of this, very much spearheading what I hope to be a real revolution.
Thank you.
I've had the best time on the HSMA programme and I've formed some really, really fantastic relationships.
I would say as an analyst, it's probably the best piece of professional development I've done in my career so far, and I would encourage all other analysts to really do the same.